Order, order. We start with questions. Secretary of State for Health and Social Care, Lindsay Farnworth.
Question number 1, please, Mr. Speaker.
Start.
Thank you, Mr. Speaker. The Government is committed to making this generation of children the healthiest ever, as set out in our 10-year health plan. That is why we are investing £200 million to strengthen healthy baby services through Best Start family hubs, expanding mental health support to nearly 6 million young people in school or college, and using interventions like passing the Tobacco and Vapes Act to create the first smoke-free generation.
Lindsay Farnworth.
Thank you, Mr. Speaker. Businesses in Amber Valley are doing brilliant work to improve health outcomes for children and young people. Ferrero in Alfreton is encouraging children to be more active through its Joy of Moving programme, whilst SC Johnson, headquartered in Denbigh, is launching a hand hygiene pilot in schools to reduce absences. Will the Minister commit to meeting with me to discuss these initiatives so that we can learn from the excellent work being done in Amber Valley and develop it nationally?
Minister.
I thank my honourable friend for highlighting this important work in her constituency, and initiatives like these by Ferrero and SC Johnson complement the action this government is taking on prevention to improve children's health, including our £1 billion investment in PE and school sport. I commend them for their work in these important areas, and I'm always happy to learn more about them. Thank you.
Sir Julian Smith.
Thank you, Mr. Speaker. One of the best ways to improve the health of neurodiverse young people is high-quality ADHD and autism assessments. The government is proposing to cut substantially the amount paid to providers. Would the Health Secretary speak to providers in this area, because this cut could have significant implications on the standard and quality of autism and ADHD assessments?
Don't do it. Minister.
As the honourable gentleman will be aware, there is currently a white paper on SEND currently out for discussion, and the government will be looking at improving assessment, diagnosis and support for all children with special educational needs and disabilities, and that includes autism.
Dr. Ray Tibble.
Thank you, Mr. Speaker. Yesterday I had the pleasure of welcoming the Barnsley-based charity Limbo Foundation, along with the Limb Loss and Limb Difference Alliance, to Parliament to celebrate Disability Pride Month. The Alliance launched their campaign to end the postcode lottery of services and support for people with limb loss and limb difference. While the NHS has a strong policy framework in place, including the 2025 prosthetic service specification, the key issue is not policy, but inconsistent delivery across the country. Will the Minister meet with me and the Alliance to discuss how we can secure better access to mental health services, fair and consistent prosthetic provision, and lifelong joined-up pathways for people with limb loss and limb difference?
It doesn't happen. Minister.
Thank you, Mr. Speaker. And it was an absolute pleasure to join my honourable friend at the event yesterday to meet with campaigners and to mark Disability Pride Month. We are committed to ensuring that no matter where you are in the country, you have access to healthcare and support that you need. Ministers would be very happy indeed to meet with her to discuss this further.
Claire Young.
Thank you, Mr. Speaker. Less than half of children in Thornbury and Yate have seen an NHS dentist in the last 2 years, exacerbating health inequalities. The supervised toothbrushing programme is currently undergoing evaluation for its effectiveness, but I hear uptake is low. So what other measures does the Minister plan to take to tackle oral health inequalities for children, and will she commit to reviewing NHS dental provision in my constituency?
Minister.
The most common reason, as I'm sure she's aware, that children aged 5 to 9 are admitted to hospitals is for tooth decay. And that is why since 25-26, £21.5 million has been allocated to support supervised toothbrushing in schools and nurseries in the most deprived areas in England, and that will include the Honourable Lady's constituency.
Elsie Blundell.
Question 2, Mr. Speaker.
Minister.
Thank you, Mr Speaker. We know that the devastating impact of failures in maternity care from the courage of women, families and many of the staff. We will reform maternity and neonatal services, translating Baroness Amos and Donna Ockenden's recent recommendations into a national action plan by the end of the year, and we will create a statutory maternity and neonatal commissioner and are extending Martha's Rule so families' concerns are listened to. And under this government, we're investing £186 million to improve maternity and neonatal estates.
Councillor Blundell.
Thank you, Mr Speaker. The publication of Baroness Amos' report into the state of maternity care in England was a sobering moment for many across the country, especially those who still live with the trauma related to failings within maternity and neonatal care. There were so many instances where women were not listened to, heard or believed. Given these appalling findings, what steps will the government now take to ensure that the voices of women will be heard, including those in the North West who have been historically overlooked, and how will this look in practice?
Minister.
Can I just thank my honourable friend for that question? I think we all can agree that the report findings were really shocking, and our thoughts are with families, the women who have suffered life-changing loss or harm. Baroness Amos's recommendations will shape a new national action plan by the end of the year, and the families are going to be at the heart of the task force who will support us in getting this right, including defining the role of the maternity commissioner, who will help us ensure that never again are women not listened to.
Stu Stone.
Thank you very much, Mr Speaker. Blackpool Victoria Hospital's maternity services have had 2 CQC inspections in recent years, 2022 and 2025, both finding inadequate or requires improvements, citing particular concerns around staffing and the care provided to mothers and babies. We all know how scary it is going into maternity services, particularly if you have a challenging pregnancy or health complications. So can the Minister provide some assurance to my constituents in Fylde about the improvements that the government are trying to seek at Blackpool Victoria maternity services?
Minister.
Yes, can I just thank the honourable member for his question, because of course we want to improve services across the country, and we are modernising the regulatory framework for UK healthcare professionals, making sure that we can improve consistency of approach and secure certain less burdensome regulation in this space. And the Secretary of State personally met with GMC to account for their response to some of the failings of care in Nottingham and beyond. And like I said, it's really important that we make sure that there is a consistency of care provided across Blackpool and across the country.
Caroline Golden.
Thank you. Question number 3, please.
Minister.
Thank you. The social prescribing service is a vital part of the shift from hospital to community and from sickness to prevention. That's why we are funding social prescribing link workers in primary care to connect patients with preventative community support, and why we're granting £3 million to the National Academy of Social Prescribing to support staff training and local infrastructure. Social prescribing will also be at the heart of our neighbourhood health service so that community-led care can really transform lives.
Caroline Golden.
Thank you, Mr Speaker. I thank the Minister for his answer, and I would agree social prescribers do a fantastic job. I recently met veterans outdoors in near Totnes and visited the Vounder Therapy Garden project at Eden on a fantastic parliamentary knowledge scheme visit, and they are doing incredible work turning lives around for people particularly who have mental health challenges. But these projects receive absolutely no funding at all, despite the fact that the National Academy for Social Prescribing finds a return of up to £8.56 for every £1 invested. So how does the Department for Health expect these projects to survive and broaden their reach with no funding at all? Given their cost effectiveness, will the government commit to funding not just the link worker, the social prescriber, but encouraging ICBs to also fund these amazing projects?
Well, I thank her for that question, and I'm sure she would welcome the £3 million that we are granting to the National Academy for Social Prescribing. Social prescribing is something that needs to be commissioned locally by ICBs, and I am confident that as and when it delivers a valuable service, those services will continue to be commissioned by those ICBs.
Chris Evans.
To provide treatment for alcohol and drug dependency, charities like Change, Grow, Live need to use the NHS electronic prescription service, which has been unavailable to them till recently. The government has agreed to allow access but has provided no timetable. Will the Minister set one out today?
Minister.
I thank him for that question. We are absolutely committed to electronic prescribing, and I think he particularly means in relation to pharmacy services. We are launching new initiatives in terms of the shift from analogue to digital, and I'd be happy to meet with him to discuss a bit further in terms of the detail of what he's been asking about.
Gregory Stafford.
Question number 4, sir.
Secretary of State.
Mr Speaker, this government is committed to improving the health and well-being of our hard-working NHS staff, and we have set an ambition to reduce sickness absence to its lowest recorded level. As part of meeting that ambition, we've launched new staff standards to improve their working lives, and we will introduce staff treatment hubs focused on the biggest causes of sickness absence.
Gregory Stafford.
Thank you, Mr Speaker. And as the Health Secretary is a numbers man, perhaps he'd be interested in these figures. Research from Policy Exchange showed that sickness absence in the NHS costs £6 billion and removes 8 million clinician days from the front line. So what is the Secretary actually going to do to get staff back to work, to get patients treated, and to get this ridiculous level of staff absence down?
Mr Speaker, the 10-year health plan committed up to our ambition to reduce sickness absence from 5.1% that it was in July 2025 down to the lowest recorded level in the NHS of approximately 4.1%. And as I set out in my earlier remarks, staff standards cover health and well-being, line management, flexible working, tackling violence and racism and championing sexual safety. And the staff treatment hubs that I mentioned, which we rolled out in 2027, will focus on mental health and back conditions, which are the main reasons for absence.
Matt Reader.
Mr Speaker, we know that sickness absence and stress is often related to the workplace that people work in. And with £17 million now invested in Northampton General for a new urgent treatment centre and enhanced A&E opening this summer, does the Secretary of State agree with me? It's proof again that it's the Labour government invested the infrastructure our staff need to keep them safe and keep us safe too.
I absolutely agree with my honourable friend. He is absolutely right to point to the record investment that this Labour government is putting in, not just to the day-to-day running of the health service, but also that critical capital investment after, for so many years, the capital budget was starved under the party opposite.
Andrew Peggs.
Question number 5, Mr Speaker.
Secretary of State.
Mr Speaker, this government will invest up to £10 billion on NHS technology and transformation by 28-29. That includes ambient voice technology, which supports doctors to write up notes quicker so that they can focus on patient care, and the single patient record, which will bring a patient's health data into one secure system, limiting repetition across services. We will use technologies like these to free up staff time so they can spend more time on care and less on administration.
Andrew Peggs.
Mr Speaker, it is welcome news the government is making progress on digital infrastructure and the single patient record, which is good news for patients and for the NHS. But in a trust like North West Anglia, patients in Peterborough risk missing out on some of the benefits because of the poor state of the hospital and the trust IT. I thank the honourable friend on the front bench for engaging with me on this issue previously. But what reassurance can the Secretary of State give? The Department will work with NWAF to ensure that we have the infrastructure we need in Peterborough so patients in my constituency benefit the most.
Mr Speaker, may I put on record that my honourable friend has been a most determined advocate for patients and staff at North West Anglia Foundation Trust, who clearly deserve better IT systems. We've agreed plans to replace the Trust's electronic patient record system and supporting infrastructure, and we will go on to provide practical support and guidance, including help with costs, and we will pair the Trust with other NHS organisations who have overcome similar issues in the past.
Katie Lamb.
Thank you, Mr Speaker. I spent a day last week with the palliative care team at William Harvey Hospital in Ashford, which services a large chunk of my constituency. And I was amazed by how much time they spend just gathering and sharing information, clicking through on really old systems, all on PDF, a huge period of time that they could instead be spending on clinical care, especially given how technology is evolving. When are we going to get past this situation where, every single time basically a doctor sees a patient, it's like the whole interaction with the NHS is happening for the very first time?
Secretary of State.
Well, Mr Speaker, the honourable lady makes a very compelling case for the investment that we're putting into transforming digital infrastructure in the NHS, because the single patient record, which is being introduced with the health bill currently going through Parliament, will enable systems across the NHS to be linked up, so that people will no longer have to repeat their stories time and again to different clinicians or different people who they seek care from. It also means that people will have their health records linked up when clinicians are deciding how to treat them. So it's a win-win for patients and for clinicians when they're looking at the opportunities that the new technology provides.
Greg Smith.
Number 6, sir.
Minister.
Thank you. We remain absolutely committed to the GP partnership model, which supports continuity of care, efficiency and innovation. So where it's working well, it should of course continue. But what is important is that patients are getting the care they need, regardless of the model. And the GPPS shows that 77% now rate their experience as good. Step by step, this government is getting general practice, the front door of the NHS, back on its hinges, Mr.
Speaker.
Thank you, Mr. Speaker. I'm grateful to the Minister for that answer, but GP partnerships across rural areas like mine in mid-Buckinghamshire are facing considerable uncertainty as the government reviews the model for practice funding. So can the Minister be really clear when the next steps of the Carr-Hill review are going to be published? And within that, in rural areas like Buckinghamshire, facing incredible housing pressure from this government and from other departments, that rural areas will not be disadvantaged in that?
I thank him, and the Carr-Hill review is absolutely ongoing and will be publishing very soon. In terms of access right across the country, we've invested an extra £1.6 billion in general practice, recruited over 2,000 more GPs and extended online services throughout core hours, helping deliver 12.7 million more appointments compared to last year. More than 3/4 of people now say it's easy to contact their GP, up from a very disappointing, I'm sure he will agree, 61% in July 2024. Mr. Speaker, when we entered office, general practice was on its knees, but we are rebuilding it, and I'm incredibly proud of what we have achieved over the last 2 years.
Sarah Coombs.
And I'm very grateful to the government for all they've done to improve the NHS. On the point about different models of GPs, I have a local NHS Trust chain of GPs called Your Health Partnership, where we have struggled in some of them, particularly in Oakham, to provide the right care for communities. Luckily, the Oakham surgery and the staff there have done a good job to improve services, but can we just look carefully as a government at the different types of models for GP to ensure we ensure good care for all constituents across the country?
Good question.
Well, my honourable friend is a tireless advocate for her constituents, and she's absolutely right that the outcomes for patients is far more important than the model. GP practices are, of course, regulated by the Care Quality Commission, and we expect the local ICB to take action if services are not meeting the reasonable needs of her patients, and I'm sure that she will continue to assiduously ensure that those high standards are being delivered.
Rishi Sunak.
Thank you, Mr. Speaker. I know that Minister appreciates that access to GPs in rural settings is incredibly important. So there was great concern when my Yorkshire Dales community faced the closure of the Reeth medical practice. After a concerted effort by many, thankfully a solution was found to maintain services at Reeth. So will the Minister join me in thanking all of those involved, especially Lynn Irwin, the Central Dales practice and everyone at the Richmondshire Primary Care Network? And will he also welcome their ambitions to in fact expand services at Reeth as a result of the new collaborative partnership that the new approach has put in place?
Well, I thank the right honourable gentleman. I'm sorry to see him on those crutches. I hope that he'll make a speedy recovery. I'm sure under this government he'll be greatly helped to do so. I'd also like to pay tribute to Lynn and the team that he mentioned there. It sounds like they're doing absolutely sterling work, and it's that vital role that the front door of the NHS plays. Our general practice is such an important part of our community, and he is assiduously championing their cause.
Atkinson.
Thank you, Mr. Speaker. The GP patient satisfaction survey is out, and I'm really proud that Sunderland Central and East PCNs show satisfaction of 83%, notably higher than the national average. So will the Minister join me in thanking everyone that works in primary care in Sunderland for that, but equally recognise that there's more to do? And I wonder what the Minister believes is the role of primary care at scale as part of that. We have the Sunderland GP Alliance working across Sunderland as a whole. What is his intent in terms of policy around primary care at scale in further improving access?
I would certainly like to join him in congratulating the team. That sounds like an absolutely outstanding service that they are providing. He's right to point to primary care at scale as a way in which we can genuinely deliver that shift from hospital to community and from sickness to prevention. That is the level of ambition that we have in our 10-year plan, and it's thanks to teams like the one that he so brilliantly champions that we are going to deliver on what we said we will deliver in this 10-year plan.
Dr. Luke Evans.
Thank you, Mr. Speaker. And the last Health Secretary told The Times before the election, quote, "I'm minded to phase out the whole system of GP partners altogether and look at salaried GPs working in modern practices alongside a range of other professionals." He later then clarified, and I want to quote, "sort of phase it out over time." He has now gone. So is this perspective shared by the new Health Secretary?
Minister.
Well, I refer my honourable gentleman to my previous answer. We remain absolutely committed to the partnership model, but we are also absolutely committed to quality and standards for patient outcomes. So really it's about delivering the outcomes that patients need. The way in which we do that is of secondary importance to the actual delivery of quality outputs and outcomes for patients.
Steve Darling.
Question 7.
Oh, sorry, I do apologise. There is a second question from Dr. Luke Evans.
I'm very grateful, Mr. Speaker, for you giving me the time, and I'd like to thank the Minister as well for his answer. But he didn't quite clarify, because I've actually asked him this question before in a Westminster Hall debate, and he said, "I don't think it's right to say that there's any specific plans to change the partnership model, but we do recognise there are a number of other ways, and we will always keep the ways in which the contract is delivered under review." So given the profession is looking at balloting for a Plan B for general practice, akin to NHS dentistry, could the Minister clarify whether this model is under consideration by the government?
Minister.
Well, I thank him, and I thank you, Mr. Speaker, for giving the honourable gentleman the opportunity to ask that second question. I'm absolutely delighted that you did that. So look, what I was missing in both of the honourable gentleman's questions was a congratulations to the government for the outstanding achievement. When we came into office, 61% were satisfied with access to their GPs. Mr. Speaker, that now stands at a stunning 77%. So I'm still waiting for the words and congratulations from the honourable gentleman for that. But as I say, there is no attempt to change the model. The model is that there is a partnership model which works, but where it isn't working, of course, we look at other options. He seems to be obsessed with the inputs to the system rather than the quality of the outcomes that we deliver, and that perhaps explains why there was so much neglect and incompetence over 14 years of Conservative government.
Steve Darling.
Question 7.
Minister.
Thank you, Mr. Speaker. And with your permission, I will take question 7 and 19 together. Heat waves place additional pressure on hospitals, and we commend NHS staff for their continued professionalism in recent weeks. Our 10-year capital plan committed to renew our focus on climate resilience, and we are investing £6.75 billion in the most serious safety risks, including risks to cooling and ventilation. We are also ensuring that heat resilience is a key part of future building design.
Sorry, Steve Dunn.
Thank you. Torbay Hospital is the third oldest estate that celebrates part of being the NHS. The tower block in heatwave conditions is like an oven that has a massive impact on patient, staff and even equipment. Does the Secretary of State acknowledge that it is time to acknowledge that buildings are time expired, and in light of this we need to accelerate investment into Torbay Hospital?
Minister.
Thank you, Mr. Speaker. The new hospital programme standardised design is incorporating climate adaptation plans, and all new build neighbourhood health centres will be required to undertake a climate change risk assessment. He mentioned Torbay Hospital, and he will be aware it's in wave 2 of the new hospital programme as set out in the plan for implementation, and construction is expected to commence between 2032 and 34. But I hear what he says about bringing that forward. I can't commit to that at this stage, but we have heard him make his point. Thank you.
Gary McAlpha.
Thank you, Mr. Speaker. I appreciate the government's plans to upgrade the NHS estate, but the heat waves are happening now and staff and patients are enduring unbearable conditions, wards without AC, temperatures of more than 30 degrees, radiotherapy machines and MRI scanners failing, IT servers overheating and so on. And this is all with many more hospital admissions as well. So what is the government currently doing to ensure that safe patient care can still be provided this summer and that the staff can be provided to do their jobs properly too?
Minister.
I thank the Honourable Lady, and she is right that health infrastructure must be equipped to deal with these heat waves. They definitely look like they're here to stay and not just happening on the odd occasion. We are investing record sums in setting clear design standards to ensure that the NHS estate can adapt to all forms of risk, including heat, and providers are also supported by UK HSA guidance under the Adverse Weather and Health Plan.
Thank you, Mr. Speaker. Heat waves, which are becoming more frequent and more severe due to the climate crisis, create a health crisis. We see that in excessive temperatures in our hospitals and other health buildings. We see it in the huge, unprecedented demand on ambulance services. So will the Minister support my colleague Hannah Spencer's private member's bill to set a maximum workplace temperature to help keep people healthy during heat waves? And in what conversations is her department having with the Cabinet Office to make sure that we've got a government-wide adaptation and resilience plan to deal with the effect of climate breakdown?
Can I just remind members not to use their names but constituents in future? Yeah, don't worry, it's fine. Minister.
Thank you, Mr. Speaker. All employers have a legal duty to ensure a reasonable temperature for indoor workplaces, and the Health and Safety Executive is planning to consult and propose changes to the approved Code of Practice for the Workplace Health and Safety and Welfare Regulations from 1992, including those relating to workplace temperatures. As I'm sure everyone is aware, 1992 is a long while ago, and the heat waves that we are seeing now are becoming more and more prevalent, so this work is very much needed. We are investing record capital to ensure the estate is fit for the future and NHS staff have the safe, modern workplaces that they deserve.
Jen Craft.
Mr. Speaker, on a visit to Basildon Hospital last week, staff told me how dealing with the unprecedented demand due to the heatwave was compounded by a building that is fundamentally unfit to cope with extreme heat, not least an A&E with working above capacity with absolutely no windows. Will the Minister work to make capital funding available for hospitals such as Basildon to allow them to adapt to the 21st century, particularly given that the east of England is the region most impacted by changing climate?
Minister.
So all NHS trusts and all adult social care providers are required to have robust business continuity plans in place to respond to adverse weather events. And DHSC works closely with NHS England, UK Health Security Agency and the rest of the government to plan for extreme heat. I can't recall in my time that we've had as much discussion around this issue. So obviously, going forward, this is something that we're going to have to look in more detail.
Morgan, Liberal Democrat spokesperson.
Very much, Mr. Speaker. The recent heatwave has also caused an increase in A&E corridor care, something that NHS emergency departments weren't built to cope with, let alone the corridors. 69,504 instances of corridor care were recorded in May this year, increasing to 72,955 in June. Corridor care is dangerous in its own right, but there have been reports of temperatures up to 40 degrees in British hospitals. One Surrey consultant was reported in The Guardian as saying, "This heatwave has pushed patient care into concerning territory. In the heat, corridor care has become more serious and more unsafe." So, will the Secretary of State or the Minister consider Liberal Democrat plans to end corridor care for good and to ensure that the hospital building programme is accelerated, because no one should be treated in an inhumane space?
Minister.
Thank you, Mr Speaker. We are the first government in history to commit to publishing data on corridor care. And we need, in order to know what needs to be done, we need to know the size of the problem. And we have committed to ending corridor care by the end of this Parliament.
Question number 8, please, Mr Speaker.
Thank you, Mr Speaker. Losing a child is devastating and no one deserves to experience such losses alone. I know my honourable friend is a keen supporter of the Love Jasmine charity in her constituency that provides vital support to families that have suffered child loss. We're making sure local NHS services provide easily accessible bereavement support, and local integrated care boards should make sure service provision is tailored directly to the needs of grieving families and their communities.
Thank you, Mr Speaker. The death of a child seems to violate the natural order of things, leaving parents shocked, grieving and in unimaginable pain. The charity Love Jasmine in my constituency was founded by Rob and Cathy Lapsley in 2016 after the death of their daughter Jasmine, to support other bereaved parents on Merseyside through counselling, support groups, advocacy and practical advice. Since then, it's helped over 900 families and received a constant stream of NHS referrals, but without any commissioned NHS funding. It now faces a funding crisis after the loss of its National Loss Refund due to new criteria leaving it operating a limited service and under threat of closure, whilst families face longer waiting times for support elsewhere, less designed to their needs. So will the Government consider carefully the strong case for NHS Commission funding for the kind of specialist support for bereaved parents that Love Jasmine offers, so that this service, so trusted by the NHS across the North West, is not lost?
Thank you, Mr Speaker. Can I say that I commend the work of Rob and Cathy Lapsley, having been through such a terrible loss themselves. They've been providing support to parents across Merseyside who face such tragic circumstances. It is vital that bereavement support is available and offered with sensitivity, choice and respect for what each person needs. ICBs must ensure that there is sufficient provision for bereavement, including working with the voluntary community and social enterprise sector, and we are investing £25 million to enhance bereavement facilities and maternity and neonatal services. And can I thank my honourable friend for championing the charity Love Jasmine.
Mr Speaker, Dorothy House has a space called Bereavement Help Point, where people who are grieving can meet others who are grieving. This service relies entirely on volunteers, and the trauma of baby loss can last a lifetime. A charity like Dorothy House cannot cover all the need. Does the Minister agree that this service should not be a nice-to-have, but an essential part of trauma care?
Minister.
Can I thank the honourable member for her question? And absolutely right, I do agree with that. All parents should have choice and respect for what is a very sensitive and very difficult time. But as of January this year, all integrated boards in England have indicated that trusts in their areas offer 7 days a week bereavement service across maternity settings, so that support is available when families need it most. But I'd be happy to talk to her if there were any further concerns.
Question number 9, Mr Speaker.
Secretary of State.
Mr Speaker, the health bill going through Parliament will restore clear accountability to the NHS. By abolishing NHS England, we are ending the confusion created by having two separate centres. Responsibility for national decision-making will be brought back to government, whilst local leaders will be empowered to deliver for their local communities.
Yasmin Qureshi.
Accountability in the NHS must run down to the patient as well as to Parliament. Local health organisations provide independent voice when services fall short. What safeguards will the Minister put into place to ensure that as their functions are moved to the Integrated Care Board and the local authorities, that patients in Bolton South and Walkden retain genuine independent route to raise concerns, and that as the Local Government Association has warned, that we can't let the NHS left marking its own homework.
Well, I thank my honourable friend for her question, and I think it's fair to say that whilst in some areas Healthwatch has played an important role. It has fundamentally separated those listening to patients from those who have the power to make changes. And what our reforms in the health bill will achieve is to put patient voice at the heart of shaping services. Those responsible for commissioning services will hear directly from patients, service users and local people. My honourable friend asked about ICBs. ICBs will be required to publish an annual statement of how they have gathered feedback and what actions they have taken, whilst the new Patient Experience Directorate in the Department for Health and Social Care will ensure patient insight directly shapes national policy making.
Sir Jeremy Hunt.
Thank you, Mr. Speaker. The Secretary of State knows of my concerns about the lack of accountability to bereaved parents because trust lawyers advise trusts to ignore their duty of candour when there is the prospect of legal action. I was hoping to get this addressed through an amendment to the Public Office Accountability Bill, but it looks like that amendment won't be voted on. So will the Secretary of State address this in the health bill so that parents know they can be sure that trusts will always tell the truth after a tragedy?
Well, I thank the right honourable gentleman for raising this very important point, and the amendments that he's tabled, whilst my understanding is they won't be voted on today, raise a very important issue that I will continue to look further into. Of course, with the Hillsborough Law now due to have its common stages completed today and then go over to the Lords, I very much hope it will be in law as soon as possible, which means that we can then apply the duty of candour to future maternity services reviews, such as those in Leeds and Sussex, because the situation we had in Nottingham, where senior leadership refused to take part in the inquiry underway, was totally unacceptable and must never happen again.
Rushworth.
Number 10, Mr. Speaker.
Minister.
Thank you. We are improving access to NHS dentistry with reforms to prioritise those in greatest need by creating an urgent care safety net throughout the country. I am proud to say that we're on track to deliver 2.5 million additional treatments, and that survey data released last week shows 81% of patients were able to get an appointment in the last 2 years. But we will go further with fundamental reform in this Parliament.
Sam Rushworth.
Thank you, Mr. Speaker. I thank him for that answer. But in the area that I represent, we have a problem because we had NHS dental practices close in Shildon and in Bishop Auckland in the year before the general election. But just recently, another practice in West Auckland has been writing to patients to say they can't provide NHS care. And while I respect and I really appreciate the work the government's done on emergency dental treatments, for primary care dentistry, it's still simply not good enough. And I know that he knows this, we've talked about it, but will he commit to continuing the reform of the contract at pace and also recognise that we need to better fund NHS dentistry? Will he meet with me or his officials to discuss what we can do to help the patients that are being affected in my constituency?
Minister.
Well, I thank him for that question. He's a tireless advocate for his constituents. Integrated care boards are responsible for commissioning NHS dental services to meet the needs of their local population. Where a dental practice decides to close, NHS England and the relevant ICB work together to ensure their patients have access to dental care. However, I absolutely accept his point that we have still got a long way to go to get NHS dentistry back on its feet, and I would be more than happy to meet with him to discuss this further.
Graham Stewart.
It's good to be. I must say to the Minister that his honourable friend is right about dentistry, and we've had no clarity from the Minister as to the vision for the future. What should people expect? Is it planning that most people should go private and not be able to access the NHS dentistry? Because when I chaired the Holderness Health meeting on Friday, the ICB told me that just 39% of people are able to get access to NHS dentistry within 2 years. That's the reality for people in rural Beverley and Holderness today. And what we'd like to hear from the Minister is what's the vision for the future? What could we expect by 2029, 2030? Because right now, all we get is words and no real clarity.
Minister.
Thank you. I have a lot of respect for the honourable gentleman, but I have to say, taking lectures from the party opposite when they had 14 years to fix NHS dentistry and did absolutely nothing about it, it is a bit rich, Mr. Speaker. But look, our ambition remains to deliver fundamental reform before the end of this Parliament. It is a complex issue. There are various contract models, capitation, blended capitation, care packages. We need time to get it right for both dentists and patients, but I can assure the honourable gentleman that we are working on it and the public consultation will be launched soon.
Adam Joggi.
Question 11, Mr Speaker.
Minister.
Thank you, Mr Speaker. The health inequalities that exist in our country, including in Staffordshire, are an intolerable injustice, and this government is taking action to tackle them. From the Tobacco and Vapes Act to the new Heart Disease and Strokes Plan, through the 10-year health plan, we are tackling the root causes driving ill health.
Jokey. Thank you very much, Mr Speaker. Audley Health Centre in Newcastle and Lyme is the 5th worst practice for asthma prevalence in our ICB and the highest rural practice for people living with COPD. Local GP Dr Richard Page puts this down to prevailing wind blowing pollution from the M6 on the west side of the practice area, and also notes that if Greenbelt land is released for the AB2 development, pollution will only get worse. So can I ask my honourable friend the Minister, and it's excellent to see her at the dispatch box, to set out what this government is doing to ensure that the people of Audley and anyone else living in areas with high levels of pollution are not disproportionately affected by respiratory diseases, and will she meet me to discuss?
Minister.
I thank my honourable friend for his question and his good wishes. Improving air quality is a core part of the government's shift from treatment to prevention in our 10-year health plan. And I know my honourable friend is very committed to cleaner air in his Newcastle-under-Lyme constituency, and I commend him for all of his hard work in campaigning on Wally's Quarry. And I know that his constituents will be very grateful for his work on that. With MHCLG, we have introduced a new duty on strategic and combined authorities to have regard to improving population health and reducing health inequalities, which specifically references air quality as a factor for their consideration. And if time allows, and I'm still in post, I would be happy to meet with him.
Dr Caroline Johnson.
Thank you, Mr Speaker. Mr Speaker, one measure which can be helpful tackling inequalities across the country is independent feedback. Currently, Healthwatch collect independent feedback right across the country. Does the Minister agree with this government's plans to abolish Healthwatch, or does she share the concerns of the Right Honourable Member for Makerfield, that it will actually reduce the independent voice?
In Staffordshire. Minister.
As the Honourable Lady knows, we are putting patient voice right at the heart of the health service. So whilst she may say we are scrapping something, we are actually going to make it better.
Dr Caroline Johnson.
Thank you, Mr Speaker. I'm not sure it's just our side of the House that's saying it. But from Staffordshire right across the country, more doctors can help in reducing inequalities. And many Labour members from the Cabinet to backbenchers promised this government would double the number of medical school places. The former Secretary of State and the current Minister for Primary Care repeated that promise at the dispatch box. We were then told in a ministerial correction that the government had never committed to doubling the number of medical school places. How can this be accurate? Is it government policy to double the number of medical school places, or is this a promise that they intend to break?
Minister.
I know the Honourable Lady has asked me about the 10-year workforce plan on many occasions, and it will be out shortly. And in that plan, she will see that we are prioritising British graduates entering the workforce.
Okay. To say it, though. Exercise those knees. He's getting old.
Football, Mr Speaker. Sorry. It's Tuesday.
Who's dealing with it? Anybody want it? Oh, well done, Bill.
Thank you, Mr Speaker. The lung cancer screening programme is already making a difference by helping find lung cancers earlier, when they are easier to treat. By focusing first on areas with the greatest need, it is also helping narrow the gap in lung cancer outcomes. The programme can also identify other serious health conditions. Clear NHS protocols are now in place so that these findings are followed up and patients can get the right care as quickly as possible.
Okay.
Thank you, Mr Speaker. If there's a five-a-side doctor in the House, I'd be most grateful at the moment. Following on from my honourable friend from Newcastle-under-Lyme, chronic obstructive pulmonary disease is one of the big killers in my constituency of With Insurance Sale East. Chiesi, a company based in my constituency, is leading the fight in early diagnosis. Therefore, can I ask the Minister what assessment she's made of the Frontier Whole programme in tackling this and commit to scaling this up nationally to improve patient outcomes and saving our NHS money.
Minister.
Thank you, Mr Speaker. And I thank the Honourable Member for highlighting the excellent work of Hull University Teaching Hospital and KAZ. The NHS has delivered spirometry tests in community settings, including CDCs, to diagnose COPD missed in the pandemic, and the lung cancer screening programme also refers patients to primary care, including for COPD.
That was funny. We had two members before, obviously a bit of intimidation on the benches. Jim Shannon.
Never intimidation, I'm not strong enough for that. But my colleague and friend was very kind to let me do this. As chair of the Respiratory Health APPT, I want to ask this question. The lung cancer screening programme has been an enormous success, and the Minister knows that. The low dose of CT scan regularly identifies clinically significant incidental findings. So what progress has the Minister's Department made in ensuring that incidental funding is followed up, and when will the national guidance be issued on this, preferable as part of a modern service framework for respiratory health? Thank you so much.
Minister.
Thank you, Mr Speaker. The NHS lung cancer screening programme has clear national protocols and quality assurance arrangements to ensure clinically significant incidental findings are reported, followed up and acted upon appropriately to help ensure patients receive timely assessment and treatment through established NHS pathways.
We come to topical syrup poaching.
Number one, please, Mr Speaker.
Secretary of State.
Mr Speaker, as you know, my honourable friend, the Minister of State for Health, is not here this morning as she is attending her son Will's graduation, and I'm sure the whole House will want to join with me by putting on record our congratulations to Will for his achievement. Mr Speaker, since I last updated the House, we have opened a new meningitis B vaccination programme for 1 million young people. We have committed to extending Martha's Rule across all maternity services, and we have resolved a long-running dispute with the resident doctors. Mr Speaker, we have not wasted a second in strengthening and improving our health and social care system for people across the country and building an NHS that is fit for the future.
Thank you, Mr Speaker. Now that the capital spending plan has been published, can the Minister confirm whether Warrington and Halton will receive the funding for a desperately needed new hospital? The existing hospital estate has not been substantially upgraded since the 1960s and can no longer cope with the capacity needed to serve the growing local population. Will he commit to delivering a modern hospital for the next generation, including residents of Runcorn and Helsby?
Mr Speaker, we want to improve the NHS estate across the country, which is why we are increasing capital investment to £15 billion a year by 28-29. In terms of the specific investment in her constituency, I'm happy to write to her with further details.
Alex Mayer.
Thank you, Mr Speaker. The Houghton Health Hub that I recently visited is very well located in the town centre next to a library. It's owned by the council, leased by NHS Property Services, who in turn are paid by the ICB for the modern clinical rooms, which you can see on your right-hand side as you go in. So far, so good. The problem is that those clinical rooms are empty. Public money is literally going round in circles but not creating any health provision for patients. Will the Minister meet with me to see if this sorry saga can be sorted out?
First time.
I thank my honourable friend for raising that situation, because clearly we should make sure that NHS rooms are in use for the benefit of patients. On that specific case, I understand that Central East ICB is developing a plan for reoccupying the Houghton Regis Health Centre this month, but I'd be very happy to pick up with her in further detail.
Can we have Shadow Secretary of State Stuart Andrew?
Thank you, Mr Speaker. Is the number of patients waiting for admission for an operation or procedure today higher or lower than when this government took office?
Mr Speaker, I am proud of the fact that the waiting list for NHS services is over 340,000 less than when we took office 2 years ago. We are seeing people treated faster than ever before. We are seeing satisfaction with GP services increasing. We are making progress that we need for people across this country. There is a lot more work to do, Mr Speaker, but we have laid the right foundations and are moving in the right direction.
Well, there was clearly no answer to my question, so let me give it. The answer is higher from their own figures. And additionally, in response to concerns I raised, the Office for Statistics Regulation confirmed that the published figures do not clearly distinguish between patients who are treated and those removed from waiting lists without treatment. With consultants now taking strike action and the situation potentially getting worse, how can the Secretary of State prove that patients are actually being seen faster rather than statistics being massaged?
Mr. Speaker, the vast majority of people who come off the waiting list come off because they are receiving the care they need. And I am confused, Mr. Speaker, if he is advocating that people should stay on the waiting list when they no longer need NHS care. Are they advocating, Mr. Speaker, that we should spend NHS resources chasing people who no longer need care? Or should we, as previous governments have done, keep the waiting list up to date and make sure that everyone who needs care gets it?
Graham Stringer.
Mr. Speaker, the waiting time to see a cardiologist in the Manchester University NHS Foundation Trust is an unacceptable 66 weeks. What are the ministerial team going to do to reduce that waiting time?
Mr. Speaker, we're determined to reduce waiting times across the country, and where there are cases of individual hospitals or trusts, like the case my honourable friend mentioned, we will send in teams from the National Health Service to help improve the service provided in local areas. It's also important that where trusts or hospitals have done well and have solved problems, the expertise in those trusts or hospitals goes to help other trusts and hospitals who need their support, because we want to make sure the improvement in the NHS happens right across the country.
Liberal Democrat spokesperson Helen Morgan.
Thank you, Mr. Speaker. The NHS Resolution Annual Report for the year ended 2026 shows maternity made up almost £35 billion of the £60 billion set aside for future negligence payments, and 40% or £1.3 billion of the total clinical negligence payments last year. Now, the Secretary of State has promised to put an action plan in place by the end of the year, but the recommendations of Baroness Amos and Donna Ockenden are already published. So will he accelerate implementing those national recommendations and putting a maternity commissioner in place, because mothers can't afford to wait and neither can the taxpayer?
Mr. Speaker, as the honourable lady will know, I have committed to introducing a maternity and neonatal commissioner. I'll be meeting with the National Task Force, which I chair, later this afternoon to discuss the scope of that role, to make sure the task force has discussed that and is content with the scope that the Commissioner's role takes. We will then make sure to get that on a statutory footing as quickly as possible. I hope through the Health Bill that will be subject to discussions with the Commons and Lords authorities, but I want to make sure that role is statutory, in place, and can help us drive change through maternity services across the country.
Rachel Tick.
Mr. Speaker, the average wait for an endometriosis diagnosis is more than 9 years, often because women and girls are not listened to when they experience really painful periods. My constituent Incha waited over a decade, only to be told she could face a 3-year wait for specialist surgery. What plans does the government have to reduce diagnosis times, provide better training for GPs and improve access to specialist endometriosis care for all women and girls in North Warwickshire and Bedworth?
Minister.
I thank my honourable friend for her question, and women have been dismissed for far too long, and that must change. The renewed Women's Health Strategy commits redesigning clinical pathways for heavy periods and pelvic pain to reduce repeat appointments, unnecessary referrals and long waits. Menstrual problems, including endometriosis, will be prioritised through NHS Online in 2027, which will give people across the country the choice of getting the specialist care that they need from home.
Studies show that iodine deficiencies in pregnant women can result in complications for their children, including impaired fetal growth and psychomotor development. Recent studies have shown that iodine levels among women of reproductive age in the UK is only 82 micrograms per litre, with 30% of women recording levels below 50. But WHO guidance says that pregnant women are iodine deficient if they have less than 150 micrograms. The last governmental review into iodine deficiencies was in 2014. Will the Secretary of State ensure that a new review is urgently commissioned?
I thank the honourable lady for raising that important point and for drawing attention to the fact that deficient iodine levels can have. I'm happy to look into that matter further and respond to her in writing.
Chris Inchler.
Mr. Speaker, our NHS is heavily reliant on penicillin-based antibiotics for many of its core functions, but close to 90% of global manufacturing capacity of an essential component of these antibiotics is now concentrated in China. The risks to our NHS are obvious. So what steps are ministers taking across government to reduce our NHS's dependence on these highly concentrated supply chains?
Can I thank my honourable friend for his question? And medicine supply chains are global in nature, but we are taking steps to strengthen resilience by exploring opportunities to diversify supply chains, reduce reliance on single sources and undertake targeted monitoring of vulnerable supply chains. And we'll also hold stockpiles for pandemic and serious infectious disease scenarios, including antibiotics.
Bobby G.
Thank you, Mr. Speaker. I listened to the Minister's answers earlier on the dentistry contract, and he said that they need time to get it right and a consultation will be launched soon. Well, my local dentists are desperate to take on new NHS patients. This has been a known issue for a number of years. Isn't it wholly unacceptable the government doesn't yet have a proposed solution, let alone implemented one?
Well, I thank him for that question. The fundamental problem is that dentists haven't been incentivised to do NHS work. When we came into office in July 2024, we had a crazy situation where there was a £392 million underspend. We have sorted that now. The underspend is right down at about 30 million. As a result, we've delivered 2.5 million additional courses of treatment in terms of NHS dentistry.
Steve Yan. Steve Yan? No? OK, let's move on. Ben Goldsborough.
Thank you very much, Mr. Speaker. South Norfolk is one of the fastest growing constituencies within the United Kingdom, but that population growth is putting increased pressure on local GP services, like the Humble Yards practice. Given the government's ambition to expanding neighbourhood health provision, will the department consider funding a neighbourhood health centre or community diagnostics centre in Long Stratton and in Hedderset?
I thank him, and he's a doughty champion for his constituents. We're working with local NHS systems to identify the most appropriate places for new community diagnostic centres based on local need and health inequality. We're rapidly working to deliver our commitment of 120 NHCs by 2030 and 250 by 2035. ICB submitted their centre proposals in May, and we have now completed the initial review.
Jones.
Thank you very much, Mr. Speaker. Quality and consistency of care are vital in improving cancer outcomes. How will the Cancer Manual support earlier diagnosis, and will they include specific guidance to improve outcomes for children and young people?
Thank you, Mr. Speaker. The National Cancer Plan has a dedicated chapter on children and young people, as I know he's aware, recognising the unique challenges they face, and cancer manuals will set out clear quality standards to reduce variation in care, and we are developing criteria to select specific tumour types within that manual.
Glenn. Thank you, Mr. Speaker. The public must have confidence that where there is clear misconduct, action will be taken by medical regulators. But FOIs I submitted to the GMC found that only 6% of doctors accused of rape were suspended or erased from the register. My FOI to the NMC found that about a quarter of those accused of rape or sexual misconduct were suspended or erased. Does the Minister agree that the priority for regulators must be patient safety and not protecting their registrants?
Can I commend my honourable friend for his work and campaign in this area? And he's absolutely right. Where serious misconduct takes place, action must be taken. That's why our programme of regulatory reform will enable regulators, starting with the GMC, to act more swiftly. And we're consulting on proposals that will give the GMC a duty to remove registrants convicted of murder, rape and many other sexual offences without going through a fitness to practice process.
David Reid.
Thank you, Mr. Speaker. Air ambulance charities like Air Ambulance are vital to easing pressure on ambulance trusts and A&E, yet receive no direct government funding and rely almost entirely on public donations. Now, operational costs are rising. Fuel duty alone adds over £200,000 a year to what they'll now need to find. So, does the Minister agree that services delivering NHS-level care shouldn't depend on public generosity to survive, and will he commit to assessing how to support their continued sustainability?
Minister.
Can I thank the honourable member for his question? Air ambulance charities are a lifeline to communities across the country, and I want to celebrate the extraordinary volunteers who keep these services flying. And just to say that the Royal Devon and Exeter Hospital near him has a state-of-the-art helipad funded by £1 million donation from the Help Appeal. The facility is fully equipped and advanced lighting to allow landings 24/7 and can accommodate the latest generation of larger air ambulance helicopters.
Mr.
As you are fully aware, we've had over a decade-long campaign to see the full reinstatement of the A&E provision at Chorley and South Ribble Hospital. The public supports it, the staff supports it, the local NHS Trust supports it, and the neighbouring hospitals at Preston, Wigan and Blackburn support it. But, Mr Speaker, NHS England is blocking fully reinstatement and will not say why. Will ministers please meet with local MPs and all key stakeholders and get the A&E at Chorley and South Ribble Hospital fully reinstated?
Well, Secretary of State, what are we going to say?
I thank my honourable friend for raising this long-standing campaign that I know is of great interest to many people in the chamber today, Mr Speaker. I welcome the fact that the Trust, as I understand it, has now completed a feasibility study, and that feasibility study concluded there is an evidence-based case to explore extending to a 24-hour emergency department. This work is now being developed with the ICB, and I look forward very much to seeing those proposals progress.
And a meeting with me, of course. Alex Brooke.
Thank you, Mr Speaker. Basingstoke North Hampshire hospital rebuild has been delayed by up to 2 decades. The buildings are in a dire state and becoming increasingly expensive to maintain. Land for the new hospital is secured, so what possible justification could there be for further delay in building this new hospital?
Well, Mr Speaker, we want to make sure that new hospitals across the country, where they're in our new hospitals programme, are built as quickly as possible. We inherited a programme where there was no funding to deliver that, where the funding was completely unreasonable, when it was unrealistic in terms of the delivery timescales. We have changed that to make sure we have a clear programme with ways of delivery over the coming years. I'm happy to look into the situation the Honourable Lady raises in particular, but I would emphasise that the capital funding that our health service has lacked for so long began with funding being cut back under a government which her party was part of.
Rachel Maskell.
Thank you, Mr Speaker. Research shows that specialist palliative care can deliver palliative care in the community, saving the NHS 1.5 million bed days, but also £817 million. With the MSF, it's really important that there is funding that accompanies it so we can see an invest-to-save model moving forward. So will he meet with me and Baroness Finlay as a result of the work that we've been doing in this area to see what more the government can do to enable this?
Minister.
I thank her for that question and all the campaigning that she does on this issue. Our modern service framework will transform palliative care by basing it on strategic commissioning, which will enable us to tackle rising demand, identify patients much earlier and ensure that quality of care no longer depends on your postcode. But of course I'd be happy to meet with her and Baroness Findlay to discuss it further.
Sir Christopher Chubb.
Mr Speaker, when is the government going to implement the changes to the vaccine damage payment scheme recommended by Baroness Hallett in her report in April?
So stay.
I thank the honourable gentleman for raising that. Officials at the Department for Health and Social Care are looking at that matter closely, and we will publish the government response in due course.
Neil Duncan Jordan.
Mr Speaker, we've had 23 reviews into social care since 1997, but no agreement on how care should be funded. So does the Minister agree that the way we fund cancer care should also be the way we fund the care of those with dementia?
I thank him for that question, and dementia is a vitally important issue. We are, of course, committed to creating a national care service, and Baroness Casey's independent commission will set out recommendations to deliver this. She has made recommendations in her speech at Nuffield recently, and we are already implementing that, including the creation of a dementia czar to really push forward all of the issues, both in terms of psychosocial care and in terms of clinical research.
Ms. Logan.
Thank you, Mr Speaker. Following recent evidence of a long-term increase in colorectal cancers in the under-50s, the Scottish Government are calling on the National Screening Committee to extend eligibility for bowel screening kits to improve outcomes. I understand Australia have reduced their screening age to 45. So will the Secretary of State join with the Scottish Government in urging the NSC to review the recommended age for starting screening in order that more lives may be saved?
Safe State.
Mr Speaker, the National Screening Committee plays a vital role in providing clinical evidence and clinical advice about how to target screening programmes. In my time as Secretary of State over the last few months, there's been a number of recommendations from the National Screening Committee where the benefits of greater screening have to be balanced with the risks of doing so. I know the National Screening Committee takes that responsibility very seriously, but one point I have made very clearly to them is that they must continue to keep their advice up to date, because as new diagnostic methods, as new treatment methods become available, they need to make sure their advice keeps pace with that.
Hamilton.
Mr. Speaker, the Health and Social Care Committee is publishing its report tomorrow on fixing the food environment, which will be making several recommendations to support everyone to eat more healthily. Will the Minister commit to engaging positively with the details of our report, and could she set out the steps the government is already taking in this area?
Minister.
I thank my honourable friend for her question, and it gives me an opportunity to say how much I enjoyed appearing before her committee to discuss these matters. The government is very much looking forward to receiving the report from the Health and Social Care Committee, and I will ensure I respond to it in due course with full details.
Shocker Adam.
Young people with cancer often face severe isolation during treatment, separated from their friends and everything that is normal to them at that critical age. In Leicester South, the Leicester Royal Infirmary, this has been left to charities like Teenage Cancer Trust, who provide vital peer support funded through public donations and philanthropic grants. So can I ask the Secretary of State what steps he is taking to ensure these charities are sustainably funded so we can support them as much as they're supporting our young people with cancer?
The honourable gentleman raises a very important point about the loneliness that can often come with facing cancer and having treatment for that, and particularly when it affects young people when they are separated from their friendship groups and their peers when they're undergoing treatment. That loneliness can be particularly acute. I pay tribute to the work of the Teenage Cancer Trust. The government wants to make sure we're working with them to provide that comprehensive service, not just in terms of diagnosis and treatment, but also that important emotional support that people across the board, but particularly young people, need.
David Baines, final question.
Thank you, Mr. Speaker. Due to a long-running dispute with the building's landlords, Billings Medical Practice in my constituency has been given a deadline of September to vacate the premises. I've previously spoken with the Minister about this, and I'm grateful to the help he's given me so far, and I can tell him that now the ICB have decided to move the practice out of Billings entirely to Garswood. I'm worried about the impact of this on patients for many reasons, not least the fact that it's not easily accessible via public transport. Does the Minister agree with me that communities like Billings deserve their own medical practice, and will he or his officials please agree to meet with me to discuss a way forward?
I thank my honourable friend. We have discussed this issue. I know it's something he feels very, very strongly about, and I would, of course, be delighted to meet with him to follow up. It sounds like some progress is being made, but we need to make sure we get it sorted.
Right, that completes questions. Let the front bench change over.